Hi, I'm Rachel Brezalier, and my presentation is on the genetics of Down syndrome. Down syndrome is defined as a chromosomal condition that is associated with intellectual disability, a characteristic facial appearance, and weak muscle tone or hypotonia. It is also referred to as trisomy 21 because it is a genetic disorder caused by a third copy of chromosome 21. It is a naturally occurring chromosomal arrangement that affects 1 out of every 800 people, and it is the most common chromosome abnormality in humans. Individuals with Down syndrome usually experience cognitive delays and mild to moderate intellectual disability, but it varies among different individuals. Normally, we inherit 23 chromosomes from our mother and 23 chromosomes from our father, but individuals with Down syndrome are a result of the abnormal cell division of chromosome 21. There are 3 possible genetic variations that can cause Down syndrome. First is trisomy 21, which occurs in about 95% of the time and is the result of an individual having 3 copies of chromosome 21 instead of 2 copies. It is caused by the abnormal cell division during the development of the sperm cell or the egg cell. The second variation is called mosaic Down syndrome. This is a rare form where the individual only has some cells with an extra copy of chromosome 21. This forms a mosaic of normal and abnormal cells caused by abnormal cell division after fertilization. The third variation is called translocation Down syndrome. This occurs when part of chromosome 21 attaches to another chromosome before or at conception. Although these individuals have 2 copies of chromosome 21, they have additional genetic material from chromosome 21 that has been attached to another chromosome. Each individual with Down syndrome experiences different symptoms. Some physical symptoms can include a flattened face, a small head, a short neck, protruding tongue, unusually shaped or small ears, poor muscle tone, broad, short hands with single crease in the palm, short fingers and small hands and feet, excessive flexibility, tiny white spots on the colored part of the eye called brush field spots, and short height. Because of the child's appearance, a diagnosis for Down syndrome is made soon after birth. Although not all individuals with Down syndrome face severe medical difficulties, some of the following are common. 40 to 50% of babies with Down syndrome are born with heart defects which require surgery. Many experience difficulties with hearing and sight, thyroid disorder, poor immune system, respiratory problems, and obstructed gastrointestinal tract. However, with our advanced medical care, many of these problems are able to be treated and they are not unique to individuals with Down syndrome. Because of this, the life expectancy of people with Down syndrome has been increasing. People with Down syndrome experience different types of developmental delays which affect the individual differently. First, social development may be a challenge for children with Down syndrome, but they use many nonverbal skills, including babbling and gestures. They may experience delays in speech and language, but they learn to develop good social skills. Motor development often develops at a slower rate, which can affect the development of language. Most children with Down syndrome experience delays in expressive language. It is common to see a delay in mastering sentence structures and grammar, and specific difficulties in developing clear speech production. Children may face frustration because their ability to understand language does not match their ability to express language. This often leads to behavioral problems. Many children with Down syndrome experience difficulties with number skills and can be about 2 years behind in their reading skills. Children also have trouble with short-term memory. It is more difficult for them to understand and process verbal information than visual information. Due to all of these developmental delays, teachers learn new and creative ways to teach children with Down syndrome. Lastly, there are many interesting facts about Down syndrome. First, Down syndrome affects about 1 in every 800 babies. It affects people of all ages, races, and economic levels. The incidence of births in children with Down syndrome increases with the age of the mother, but due to high fertility rates in younger women, 80% of children with Down syndrome are born to women under 35 years of age. The average life expectancy for people with Down syndrome has increased dramatically in recent decades, from 25 in 1983 to 60 today. People with Down syndrome attend school, find work, participate in decisions that affect them, and contribute to society.